Could you describe what social determinants of health play a role in the risk for obesity?
Sure. I think that social determinants of health play a role in every aspect of medical care and of health outcomes. So that's really how we're understanding overall health today, is that there are drivers that have to do with issues such as the type of medical care that a person might receive, how they respond to that medical care, their own behaviors and lifestyle issues that go into how we look at health and health outcomes, and also our socioeconomic and community environment. And so when we take a more holistic approach, which is one that, that I feel very strongly about adopting, and we're really looking at how to improve overall health, we need to look at all of those components. And there's an interaction, really interplay between all of them. Those three things really come together. So genetics aside, which do contribute to how a disease process, the risk for a disease process, and also how that process itself may have an effect overall. If you put that aside, the other determinants are really in those areas. And the social determinants or the social drivers and whatnot have to do with how we think about the things in the environment in which a person lives and how they interact with that environment, but not something that they're directly responsible for. So, for example, we think about social determinants of health as being some of the examples might be ability to access healthcare, ability to have the right and proper nutrition in order to really see, the best health and health outcomes. It might also be the ability to have a financial wherewithal to be able to participate in medical care or any of those areas. And there's some other interplays that can go into, for example, occupation, education, those sort of things. Those are kind of more socioeconomic drivers, but the social determinants that we're looking at today, which I'm very excited that we are as in healthcare, are really, really important. So if you think about some of those areas, if you think about how a person's social situation, these social determinants might impact a disease process like obesity. Obesity and the drivers of obesity are largely related to the ability to really maintain the drivers that go into maintaining the right caloric balance, which is energy balance. And so activity levels are really important in energy expenditure, right? How active we are kind of sets your metabolic profile or tone. And then also what we consume. So it's really, the genetics, the consumption, and then that, the physical activity. So we know that there are disparities in healthcare, and that in certain communities, because of a number of factors coming together and some of these social drivers, is just much more of a risk for having chronic conditions and for having obesity play out. That can have to do with the access to proper food and nutrition. It can have to do with the ability to have time to exercise or really devote to it, or even awareness of what those factors are. And then when you start layering some of the other things like consumption of other types of, maybe substances that are harmful, alcohol, tobacco, that sort of thing, we have this total interplay. And that's kind of part of how we think about obesity as a chronic condition, is what are all those factors that are going on in any one individual's life.